You reach your hand behind your back to button your shirt, and you stop halfway. It is not because you forgot what you were about to do, but because your shoulder simply does not allow it. You try again, slower and more gently, and a sharp pain shoots up as a clear warning. Getting dressed in the morning takes twice as much time as it used to. Reaching up to a high shelf is something you do not even think about anymore. Lying down at night, you have to find that one single position that does not hurt, and if you roll over to the other side in your sleep, the pain will wake you right up. This is a frozen shoulder, and if you are watching this video, there is a very good chance you have been enduring it for much longer than you want to admit. Right now, I need to tell you something straight, which is something most people do not hear until they have already wasted many months doing the wrong things. What you are currently doing to try and break that stiffness apart, like stretching forcefully, rotating the shoulder to its maximum range, and trying to push past the pain threshold because you think pain means progress, is not only ineffective, it is actually making your shoulder tighten up even more every single day, because a frozen shoulder does not need to be broken. It needs to be persuaded, and the 3 movements I am about to show you do exactly that, with no clinic required, no equipment needed, and no need to book an appointment with anyone. Here is what is truly happening inside your shoulder joint. Frozen shoulder, which has the medical name of adhesive capsulitis, occurs when the joint capsule surrounding the shoulder joint becomes inflamed, thickens, and shrinks. Scar tissue forms inside the joint capsule, gradually limiting the space in which the joint can move. That is the reason why your range of motion is lost little by little, not suddenly, but week by week and month by month. When you forcefully try to stretch past the pain threshold, the body receives that signal as a threat and activates a protective muscle contraction reflex, causing the joint to tighten even more, the inflammation to increase, and scar tissue to continue forming. You are pushing, and the body pushes back even harder. So what the joint capsule really needs is movement within a safe range, meaning pain-free, controlled, and just enough to increase blood circulation inside the joint and gradually soften the hardened collagen. Think of the shoulder joint capsule like a piece of dried and hardened leather. You cannot stretch dry leather because it will crack. You have to soften it first, slowly and consistently. That is exactly what these 3 movements do. Now that you understand why, let me show you exactly what to do. Tonight, we have 3 movements, counting down from number 3 to number 1. These are not your regular workout exercises, but rather a recovery protocol. You only need a chair and a wall, with no other equipment required. And there is one single rule throughout this entire routine that I need you to remember right now, which is on a pain scale from 0 to 10, your absolute maximum threshold is a 3. If any movement hits a 4, stop immediately and reduce the range of motion. I also have a bonus technique at the end of the video that speeds up the recovery rate significantly. And movement number 1 is something most orthopedic doctors never have enough time to show you at the clinic. So stay until the very end. Movement number 3. I call this the pendulum release. Stand next to a table or the back of a chair and place your good hand on the surface to keep your balance. Bend your body forward at an angle of about 45 degrees. Let the painful arm hang down naturally toward the floor. Do not tense up, do not hold it. Just completely relax it. Now use the exact weight of that arm to create a small swinging motion, drawing small circles in the air in a clockwise direction. Do this for 10 circles, then reverse the direction and do 10 more circles. Do 10, do 10. The most important thing here is that you do not use your shoulder muscles to actively create force, but rather you let gravity do the work instead. The movement comes from gently swaying your hips, not from contracting your shoulder muscles. When the arm hangs down and swings lightly along with gravity, the shoulder joint space is gently stretched from the inside. That creates space inside the joint, increases synovial fluid circulation, and draws blood to nourish the inflamed tissue, all without ever triggering the protective muscle contraction reflex. This exercise was developed by Dr. Julius Codman in the early 20th century and remains the gold standard starting point in treating a frozen shoulder to this very day. The reason it has been around for over 100 years is very simple, which is that it works correctly with the physiology of the shoulder joint rather than fighting against it. If bending forward is difficult, you can sit on a chair and let your arm hang down beside the edge of the chair, as the effectiveness is exactly the same. Do 10 circles in each direction for 2 sets and rest for 30 seconds between sets. Do it much slower than you think is necessary. Movement number 2. I call this the wall walk. Stand facing a wall, about an arm's length away from the wall. Place the fingertips of your painful arm on the wall at your hip level. Now, slowly, let your index and middle fingers take tiny steps up the wall, slowly and patiently, as if you are climbing a very tiny ladder. Stop immediately as soon as you start to feel tightness in your shoulder, and do not go past that point even a tiny bit. Hold it right there for 5 seconds, breathe evenly, and then walk your fingers back down to the starting point. And here is the part I want you to do every single day, which is take a small piece of tape and stick it on the wall to mark the highest position your fingers reach today. Tomorrow, do it again and mark it again, and after 7 days, look at those marks, and you will see the progress with your own bare eyes. That is one of my absolute favorite moments when working with patients, which is the moment they look at the wall and for the first time truly believe their shoulder is recovering. The reason this movement is so effective is because it forces the nervous system to relearn. Controlled active movement within a pain-free range sends a signal to the brain that this new range of motion is safe, and the brain starts to gradually reduce the protective signals that are keeping the shoulder stiff. That is the reason why not crossing the pain threshold is way more important than trying to stretch just a little bit further. You can also do this with the wall beside you instead of the wall in front of you to practice sideways movement, depending on which direction is more restricted. Do 8 trips up and down for 3 sets and rest for 20 seconds between sets. Before we move on to movement number 1, which is the movement I consider the most important in this entire routine, if this video is helping you out, please hit the like button right now. Doing that helps other people who are suffering from shoulder pain find this information completely for free. Movement number 1. I call this the sleeper stretch. Lie on your side, facing the painful shoulder, and stretch the painful arm straight out in front of you, perpendicular to your body. Bend your elbow at an angle of 90 degrees so that your hand is pointing straight up to the ceiling. Now use your good hand to gently press the painful hand down toward the surface of the bed, doing so slowly and with control. You will feel a tight sensation in the back of your shoulder, which should not be a sharp pain, but rather a deep stretch. Stop right there, hold it for 30 seconds, breathe evenly, release it, and repeat. I need to be straight with you on this, because this is the exact thing that truly changes treatment outcomes. In 20 years of treating frozen shoulder patients, this is the movement that most people are never shown, even those who have gone to see a physical therapist. It is not because it is a secret or complicated, but because it requires an amount of explanation time that a short clinical visit simply is not enough for. The shoulder joint has many directions of movement, like lifting up, reaching forward, reaching backward, internal rotation, and external rotation. In a frozen shoulder, internal rotation is the last range of motion to be lost, and it is the very first thing that must be recovered before all other ranges of motion can return. That is why you can practice raising your arm for months, and your shoulder will never be completely free, because you are building the upper floor while the bottom floor does not even have a foundation yet. The sleeper stretch takes care of exactly that bottom floor, and I have witnessed 70-year-old patients get their full range of motion back after 8 weeks using just this movement, even people who were told they needed surgery. If lying on your side is uncomfortable, you can sit on a chair, place your painful arm on a table, and rotate your torso toward it to create that exact same stretching force. Hold it for 30 seconds, do it 4 times, and rest for 15 seconds between each repetition. I have one more thing before we wrap up, and this detail surprises most people. The first tip is moist heat before you exercise. So, before performing the 3 movements above, apply a warm, damp towel to your shoulder for 5 to 7 minutes. Do not use a dry heating pad, as it absolutely has to be moist heat. Moist heat penetrates deeper into the tissues and increases the elasticity of the joint capsule before you start stretching. The range of motion you achieve during the session will be significantly larger and much less painful compared to working out when your shoulder is still cold. The second tip is your sleeping posture, which is something that ruins the recovery process for a lot of people without them even knowing it. Do not lie directly on your painful shoulder, which is pretty obvious. But also do not let your painful arm hang off the side of the bed when you are lying on your other side. Instead, hug a pillow tightly to your chest and let your painful arm rest on that pillow, keeping the shoulder joint in a neutral position all night long. 8 hours of sleeping in the wrong posture can completely erase an entire week's worth of correct exercise progress. The third tip is the 3-point pain rule, which I mentioned at the beginning, and I am repeating it here because it is so important that it deserves to be said twice. On a pain scale from 0 to 10, your maximum exercise threshold is a 3. Progress in a frozen shoulder does not come from pushing through the pain, but rather it comes from the patience of doing things correctly within a safe range every single day for many weeks. The people who recover the fastest are not the ones who exercise the hardest, but they are the ones who never cross that threshold of 3. This is your entire routine, so print it out and put it somewhere you can see it every single day. In the morning, right after waking up, apply moist heat to your shoulder for 5 minutes, and then do 2 sets of the pendulum release. At any time in the afternoon, do 3 sets of the wall walk, and make sure to mark your progress on the wall. At night, right before bed, do the sleeper stretch 4 times, and then hug a pillow when you lie down. Please let me know down in the comments section, which direction is your shoulder most restricted in, like reaching up high, reaching behind your back, or rotating outwards. I read every single comment, and your answers help me figure out exactly what the next video should dive deepest into. If this video was helpful to you, please subscribe to the channel, because next week I will show you exactly why a frozen shoulder often comes back after you thought it was cured, along with one tiny change in your daily sitting posture that prevents that from happening. Move well, age well, and I will see you in the next video.